Hi, my name is Rogério. I'm a 24 years old Brazilian and a social physician entrepreneur. I'm passionate about breaking stigmas and raising awareness of neglected issues, mostly health literacy and mental health. In Brazil, we have 54 million people who are functional illiterate and 5 million who suffer from severe mental disorders. So we have a lot of work to do. It all begins when I entered med school and I joined an NGO of medical students that does social projects in 4 main areas. One of those areas is human rights and peace. And for 2 years, I was the Brazilian's National Officer of Human Rights and Peace. And there, we discussed about neglected populations, mostly mental health patients, and how these patients related to the health information. And for this issue is not debated and discussed in Brazil, I did a pocketbook about it and distributed it to 60 med school to raise awareness. And when we look to this relationship between mental health patients and health information and observe the medical prescription, we see that medical prescription is normally associated with bad handwriting, it comes in difficult terms, and is divided by orientations, like take this med every 8 hours, take every 12 hours, take by lunch. So it's very difficult to organize. And mental health patients have limited health literacy for their mental disorder. And many of these patients are health illiterates. And that relates to the fact that non-compliance is one of the biggest problems in psychiatry treatment. 60% of patients with schizophrenia do not take their meds correctly. So it's urgent that we need to make a new prescription that engages and puts the patients in the center of the treatment, empowering them. And we've created a new medical software that generates a new medical prescription that is easy to understand. This prescription comes organized by hours in a schedule of hours based on patient hours. It comes in easy language like take by mouth, take every day, and most importantly, it comes with pictograms, images that shows how, when, and what to take. The software is used by physicians and clinical pharmaceuticals and generates this new prescription in 40% less time than normal. We tested and validated the solution with users, as you can see.
Fala umas palavras que não tem no nosso dicionário.
Se a senhora tivesse que tomar um remédio de 8 em 8 horas, como é que a senhora ia tomar?
Vou tomar 8 horas da manhã. Vou tomar 8 horas da noite. Ela toma 2 de uma vez.
12?
É.
Eu tomava metade, 6.
Deveria receber essa ou essa?
Claro que é. Eu vou pagar.
É interessante porque todo mundo lê. Aqui entende tudo, ó.
We were in test in a public hospital, and our final version would be available in a few weeks to our early adopters. We want our solution to be adopted nationwide and even globally, since health literacy related to mental health is a global issue. People don't take meds correctly, complicate their diseases, go to hospitals, die. It costs billions in unnecessary diseases and deaths. We must take action. Everyone says that 21st century is a century of information, but we have too much information already. We want what we can comprehend. And it has passed the time for health to be understandable to everyone. And that's what we're bringing to the table. Thank you.